In today's video, we're going to talk about seasonal affective disorder. What is it and how do you manage it during the winter months? Hi folks, it's Melissa here with Natural Health Resources. Thanks for joining my channel today. Our topic is a really important topic. If you're tuning in here in November 2017, the clocks just changed. We fell back. It's getting darker a lot earlier. And if you happen to live above the Mason-Dixon line here in the United States, it's a big change in terms of how folks deal with the seasonal changes. And basically, seasonal affective disorder is something that affected my life personally. So I can speak very personally about this. About 10 years ago, I was living and working and going to school in Boston, Massachusetts. And I'm a Florida girl. As many of you know, I have a practice in Florida. I grew up in the Florida area on the water, and I'm used to sunshine, I think 333 days out of the year. And moving north was quite an adjustment. And for me personally, I dealt with it and didn't realize it. So what I want to do today is talk about a few things. The first thing I want to talk about is what is seasonal affective disorder? What are the symptoms? The second thing I want to talk about is something that I personally implemented. I did a lot of research and utilized it in my own life, and now utilize this and recommend this for a lot of patients and folks that come to my naturopathic practice. And it's highly effective at minimizing the depressive conditions or symptoms related to turning back the clocks. And seasonal affective disorder is often it's a seasonal type of depression. And it really starts for many people around October. And then it becomes much more exacerbated as soon as the clocks change for us. So during the winter months, we have darker days, the sun sets earlier, it rises later, and basically if you are working in an office space, you can drive to work, it's dark, and you leave work and it's dark, and it literally will mess with the circadian rhythm, our chemical process that alters our rising and shining and our going to bed at night. And because of the lack of sunshine at that Mason-Dixon line and above, there are greater cases in diagnosed individuals with seasonal affective disorder. It's basically a depression that comes about every year, starting in late October, really kind of reaching its peak in the middle of December around the holiday season, and then kind of making its way out of the life around March and April when we turn our clocks back and we get longer days. For many folks, it can be not only just feeling depressed, it can also be something where you feel like you could sleep all the time. Or sometimes it triggers insomnia for people because the body is not getting the natural signals of when to rise and when to go to bed. It can cause excess weight gain because the chemical composition in the brain is not balanced. The serotonin and dopamine levels are not balanced appropriately because we're not getting the natural chemical signals from our days. And the lack of sunshine, for some folks, they're more susceptible. And if you're like me, where you move from the southern area to a northern area, it tends to be much more drastic, and the onset's very, very sharp, very instant. And on top of weight gain and feeling depressed, people can feel tired. They just don't feel like they're getting their energy. It can have this kind of gloomy, like kind of experience where you feel sad. Sometimes you might be a little bit more emotional, or what we consider hormonal for women, but it affects men and women. And what I find in many of the cases that I work with a lot of folks, and they actually are now finding me on the Instant Go app on the phone. So they're texting me and calling and trying to find out how can they resolve the seasonal affective disorder. Seasonal affective disorder is something that literally changes the chemistry of the brain. And just like any type of clinical depression, it needs to be addressed from that chemical and the pre-chemical precursors. And when I say that, basically what it means is the hormones, the chemical composition in our brain, are imbalanced, and they become imbalanced because of the lack of sunshine. Hormones for women, PMS and our regular menstrual hormones, those will trigger and sometimes make seasonal effectiveness much more of an issue. Our female hormones will actually make seasonal affective disorder much more exacerbated. Sometimes the onset's faster, or the length of it is longer, or just the extent of it. Some of my clients that I've worked with actually feel somewhat suicidal. And that's a very serious condition and needs to be addressed, and it is validated by the chemistry. And what we do as practitioners, we run blood chemistry panels. We look at your vitamin D levels, and then we'll also look at some of the neurotransmitters and the chemicals that affect our emotional state. And what we find is serotonin levels take a dip during the seasonal changes, and the imbalance is what needs to be addressed. So what I want to share with you today is my protocol. I'm giving you this for free on this video because it was so impactful in my life. I literally wanted to get the heck out of Boston. I moved there in the summertime and didn't realize that summer changes pretty quickly. Coming from Florida, you have summer year round, and up there you don't. And it was such a drastic change for me. We had 12 days of rain at the end of October, and then we had the time change, and it was like, I think I remember charting it. I did not see the sun for 12 days. That was probably the least amount of sun I've ever seen in my whole entire life in a consecutive order, and it was really bad. And what I did, because I was in my naturopathic training, I delved right on into figuring out how I could fix it, and actually produced some products on the market that specifically addressed this for other people, and have been published. I've got articles that really highlight some of the effectiveness of this protocol. But essentially, there are 3 parts to my protocol. The first part is vitamin D. So most of you know vitamin D is something we say that's manufactured by the sun. It's really manufactured by your body via iris. Your iris is exposed to sunlight. There's this whole synthesis that occurs. I'm not going to bore you with the complicated chemistry of it, but just know you tend to get more vitamin D in the summertime. Sunscreen wearers, that varies too, because sunscreen minimizes vitamin D synthesis. But in the winter months, you're not going to get a whole lot of vitamin D, particularly because it's cold, you're covered up, you have less skin exposed. And people's vitamin D levels tend to plummet starting in October, and then we'll kind of sometimes see a shift. What I find is vitamin D, we want to optimize. So a lot of doctors will run your vitamin D and they'll say, oh, you're in normal range and your number's 33. Well, 33 is very much on the low end. And anybody dealing with that number, regardless of seasonal affective disorder or any type of autoimmune issues or whatever, that's too low. And so I like to optimize my vitamin D. I go much higher. Some folks I want to see at 65, some 85, and even some cases I want it in the 90s. But that's the optimal level. Vitamin D is actually not a vitamin. The science behind it, it's actually a hormone. And so when I talked a little bit about the hormones and the brain chemistry being imbalanced, vitamin D is crucial for setting up the right established balance. The second thing goes hand in hand with vitamin D and its hormone power. It is a compound that this is all supplementation. It's a compound that you can get in your body, and you definitely want to have this supervised because, again, with our brain chemistry, it's very important that all the levels are balanced, that we analyze what the levels are before we start treating. 5-HTP is the precursor to our bodies producing serotonin levels. What that means is if you have low 5-HTP levels, you don't have enough of the compounds to make your serotonin levels or rise your serotonin levels. So if there's a depletion of 5-HTP, you'll usually see low serotonin levels. But if we enhance and increase the 5-HTP, we'll actually see the serotonin levels rise. Why that's really important is seasonal effectiveness disorder actually is affecting our serotonin levels, our happy chemicals, our happy hormones. By enhancing 5-HTP, it's a very natural way of getting that into the body so that the body on its own can naturally produce serotonin. This is very different than your normal antidepressant, which is usually what people get prescribed. And in many cases, doctors won't prescribe it because it's seasonal. And so most antidepressants, you kind of slowly wean your way into it. You slowly wean your way off. By the time 4 or 5 months of this time frame of seasonal affective disorder has passed, they don't see it as an effective management tool. So 5-HTP is going to be crucial. The third thing that I like to get is B complex, B vitamin, but in its complex form. So all the B vitamins all in a single tab, or even better, a liquid, a sublingual liquid. If you get that into your diet in the morning and in the afternoon and at night, it naturally enhances your energy levels. And B12 is one of the core things that we find when we're testing, and I do a lot of testing with folks, their B12 levels are really low. So you have low vitamin D levels, you have low serotonin and low 5-HTP levels, and then you also have low vitamin B levels. And those are all the different vitamin Bs, but when we test B12, it's really low. B vitamins are water soluble, which is great because whatever your body needs, it will consume, and then whatever is left over, it flushes out. So there's no sort of toxicity. There are some Bs like niacin that will cause red flushing, so you want to make sure that you look for a supplement that doesn't have the flushing. But the B vitamins will actually make you feel really energized, and it will improve your mood. So this protocol is actually something that you can use for depression in more mild cases. I want to give that as a caveat because the chemistry in our brain is very intricate, and it's not something that you want to play around with by adding an antidepressant or taking yourself off of and weaning yourself without supervision. But naturally, these 3 compounds are a great way for you to resolve and minimize the onset of the seasonal affectiveness disorder or seasonal depression symptoms in your life. I found it extremely helpful, and I really know that if you implement this in your life, that it will be impactful. The degree of the impact is greatly varied on a lot of different parameters, but I know it will help. Those 3 compounds will actually help balance out some of those symptoms like malaise and fatigue, sometimes hair loss, and even low energy levels. So I hope you found this helpful. If you did, please give me a thumbs up. I hope you'll stay tuned for more videos coming very soon, and I am grateful as always to you watching my video. Have a wonderful day.